My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I'm a member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. I want to thank all of you who are joining us on GoToWebinar, Facebook Live, and YouTube Live, as well as those of you joining us on Twitch. The MS Society's Ask an MS Expert webcast is designed to connect you with MS experts who are ready to answer your questions on the topics that impact people living with MS every day. Please feel free to post your comments and questions in the GoToWebinar chat box. MS navigators are online throughout today's program, answering questions and connecting you with resources. As we move through the COVID-19 pandemic, the health and safety of people with MS and their families is a top priority for the National MS Society. The Society shares the most accurate and reliable guidance possible to help you find the best path forward through these unprecedented times. And today, Dr. Nancy Sicotte is joining us to discuss COVID-19 in children, vaccine guidance for people living with MS, COVID-19 antibodies, and how to continue to protect yourself and others. Dr. Sicotte is a professor and chair of the Department of Neurology at Cedars-Sinai Medical Center in Los Angeles, California, where she's also the Women's Guild Distinguished Chair in Neurology and director of the MS and Neuroimmunology program. And as chair of the MS Society's National Medical Advisory Committee, Dr. Sicotte leads the Society's COVID-19 Vaccine Advisory Group. Welcome, Dr. Sicotte. Thank you for being with us today.
Good morning, John. It's a pleasure to see you again.
Well, before we get started, I just want to remind our viewers that COVID-19 is a new coronavirus, and the published data available about this virus and MS are limited. The information and recommendations presented in this program are based upon individual professional opinion of MS experts and the evidence currently available about MS, COVID-19, vaccines, and disease-modifying therapies. The information that is shared does not substitute for your healthcare provider's recommendations, so please check with your healthcare provider before making any changes to your treatment plan. Although fewer children and adolescents have been infected with COVID-19 compared to adults, they can get sick from COVID-19, and they can spread the virus as well. Dr. Sicotte, compared to adults, do children experience milder COVID-19 symptoms?
So, John, I think that's the general consensus that when we look at the course of the pandemic and the numbers of people and the types of people that were having to be admitted to the hospital for severe COVID symptoms or who ended up in the intensive care units, it was far and away people who are older. And the older you are, the greater the risks seem to be. So it was one of the, I think, silver linings of the pandemic that at least we weren't seeing large numbers of children, which would be heartbreaking, who are having to be admitted or having very severe COVID. That said, children can become sick with COVID-19. They can be infected, and they can be asymptomatic carriers. So they can be a source of spread within the community, putting other people at risk.
Well, we've heard from Martha, who's a parent of a child living with MS, and Martha wants to know if MS puts her daughter at more of a risk for COVID-19.
So it's a great question. It was certainly a question that was on our minds as the pandemic started. For those of us who take care of patients living with MS, a big concern was, is this virus going to be something that the MS community will be hit harder by than other people because of underlying autoimmune disease? The good news is, from everything we've seen, the risk of developing COVID-19 seems to be related to the same kind of risk factors that the general public lives with. So people who have diabetes or hypertension, obesity, et cetera, underlying lung disease. But MS itself does not appear to be a risk for developing COVID-19, and that would apply, at least from what we know, for children who are also living with MS.
We've heard about multi-system inflammatory syndrome in children, or MISC. What is MISC and how serious is it?
So this is, as we talked about, that children in general don't become very ill with COVID, but this is an exception. Fortunately, this is a very, very rare complication of COVID-19 infection that we have seen cases of in children. And I just want to emphasize that this is extremely rare. Less than 1% of those children who've developed COVID have gone on to have this syndrome. And it occurs 2 to 4 weeks after the COVID infection. And so it can occur after an asymptomatic infection, which might just appear out of the blue in someone who hasn't already been known to have COVID. But it's a multi-system inflammatory syndrome, and it has some similarities to another rare disorder that children are sometimes affected by called Kawasaki's disease. And so it's an inflammation of blood vessels that affects both the GI tract. It can affect the heart. It can affect the bone marrow. And so it's a multi-system syndrome that can be, very rarely, can be fatal. It can have complications such as aneurysms on blood vessels that supply the heart, for example, which would be a serious complication. But this is treatable with anti-inflammatory approaches, and is now something that we've become more familiar with. And so that allows people to recognize the syndrome and to take action quickly. So I would say one of the hallmarks would be persistent fever, can be confusion, rash, and abdominal pain. These are all potential symptoms. So for any listeners who have children who may have experienced these symptoms, or that might, in the future, these would be symptoms to look out for. But again, want to emphasize it's an extremely rare complication of childhood COVID.
And are only children affected by this syndrome?
So there have been some cases in young adults that have been reported, but in general, this seems to be a syndrome that affects mainly children. And the studies that have been published, the mean age is in 8, 9, 10-year-old range is what we've seen. And so it's actually a very interesting syndrome. Like a lot of things during COVID, we've seen, like long COVID maybe is going to give us insights into these other more rarer kinds of post-viral fatigue syndromes that people develop. So maybe we're going to learn more about what leads to these Kawasaki-like syndromes in children after they've been affected with viral infections.
And do we know whether having MS makes a child or adolescent more likely to get MISC?
There's no evidence that that's the case. Again, it would be difficult given the relative rarity of MS in children and also the rarity of this syndrome to definitively prove that, but I have not seen any data that suggests that children living with MS are more likely to develop MIS-C.
Well, let's talk about the vaccine and adolescents. Recently, the FDA expanded the emergency use authorization for the Pfizer-BioNTech vaccine to include adolescents 12 through 15 years of age. This means that everyone 12 years old and over is able to be vaccinated. So, Dr. Sicotte, parents and children in this age group who are living with MS want to know whether the vaccine is safe for young people with MS.
Yes, well, the good news is the answer to that is yes. It is very safe, very effective, and we highly recommend that in families with children living with MS, that they go ahead and go forward to get the vaccine. This is going to be a benefit for the child living with MS, but also for the family as well. The more people that are vaccinated, the less likely we'll see virus circulating in the community, and that keeps everyone safe.
And since we're talking specifically about the Pfizer-BioNTech vaccine, do teens need to receive 2 doses to be fully vaccinated?
So the answer to that is yes. To be considered fully vaccinated, that's to through the recommended 2 doses for the mRNA vaccines, which would be the Pfizer, which is the only one that's been approved so far for children 12 to 16. The Moderna also requires 2 shots. So if you are going to proceed with vaccination, which we hope that individuals will in this age group, they should get both of them.
What about children in this age group who have already had COVID-19? Should they still be vaccinated?
So this is a great question. Overall, the answer is yes. Whether they need to go run out and get vaccinated immediately has been a question. But if the affected child has recovered from COVID, given that we now have plenty of vaccine out there, the recommendation is that individuals proceed with vaccination, even though they've had an infection, as long as they're no longer symptomatic.
And what if they've had MIS-C? Is it safe
So
for them
that's
to be vaccinated?
Yeah, so there's a lack of data about that. And so this is something, again, because of the rarity of the syndrome and because it's just recently, been available to have vaccines in this age group, we don't have a lot of data. Certainly, we would want to wait until the individual had recovered from the MIS-C, but that would be a discussion I would have with the pediatrician in terms of where the patient is in their inflammatory cascade. If there's any other evidence that there's continued disease activity, there might be a consideration of delaying. But I think in the long term, even though individuals may have had this, that they will be candidates for vaccination because we know that even after a natural infection that immunity wanes over time, and we certainly wouldn't want to put other individuals at risk who've had this complication to get another infection.
And what are some possible side effects that children in this age group might experience after being vaccinated?
So the same kind of typical side effects that many of us who've been vaccinated have experienced. So you expect some pain at the site of the injection, and maybe some fever, some muscle aches, some fatigue, and also the expectation that at the time of the second vaccination, that those symptoms might be a little bit more noticeable, a little bit more pronounced. So our recommendation in general is don't plan anything for that day after this, especially the second shot. Maybe think about a weekend. Where there is some evidence that the younger you are, the potential for having more symptoms after those vaccines is a little bit higher. And that's probably because the immune response is very robust and it tends to wane as you get older. So I like to give the example of my mother, who's 95. She had her 2 shots and didn't have any symptoms at all, felt fine. But that doesn't necessarily correlate with protection. So even though you may not have a lot of symptoms or side effects, it doesn't mean that the vaccine's not working.
And what about teens living with MS? Children in this age group, will they experience the same side effects as the general population?
That would be the expectation. And then the added wrinkle for those living with MS is for some people, they have, if they have a fever, that can sometimes exacerbate old MS symptoms. So they might feel a little bit more if they've had numbness or tingling or vision changes, that might worsen temporarily. And that's what we refer to as pseudo relapses. And I think many people living with MS are familiar with this. If they've had a urinary tract infection or they have the flu, that they, whenever they have a fever, or even if their body temperature goes up, that they start to notice some old symptoms become more pronounced. This is not a sign of a relapse. This is absolutely just this underlying worsening with the increase of body temperature. So we would recommend analgesics, lots of fluids, rest, and they should resolve very quickly.
Were children in this age group who are living with MS, were any of them included in the clinical trial for pediatric use of the vaccine?
It's a great question, and the answer to that is no, not on a specific basis, and not to have enough of those individuals to be able to, create meaningful data to answer that question. But I think from what we've seen across the board, comparing pediatric and adult onset MS, they're much more similar than different. And as time has gone on, we've seen just very reassuring information about how safe the vaccines are for people living with MS. And when I've been having clinic lately in person, and the first question I ask is, have you been vaccinated? And I'm so happy to hear that the vast majority of my patients who are living with MS have been vaccinated and have done just fine. And so we expect the same and have not seen anything to suggest that will be different for teenagers who are living with MS.
Well, we've heard from Leon, who lives with MS. He says he's been vaccinated, but he's afraid to let his 14-year-old daughter get vaccinated. He's worried that the vaccination will cause her to get MS as well. Can you tell us about the vaccine causing MS in someone who has a parent with MS?
Absolutely no data to support that idea, just as we have not seen evidence of any other vaccines that have been administered to the offspring of those living with MS has resulted in developing multiple sclerosis. So I could understand maybe a concern, but there really is no evidence and no real underlying reason why that would be the case. And given that someone is in the household living with MS, the more people that are vaccinated, the safer everyone will be. And if there's an opportunity, they should proceed with having their 14-year-old. Leon should have his 14-year-old get vaccinated.
Sally wrote in and said she's been holding off on letting her 16-year-old get vaccinated because she heard it can cause infertility, and Sally wants her daughter to be able to start a family when she's older. What can you tell us about the COVID-19 vaccines and fertility?
This is an urban legend that I have no idea how it came to be, and is another sign of the disinformation that's out there in the world. And it's very disheartening, because that's a scary thing to think that you could have a vaccine that would affect your fertility. There's absolutely no evidence of this at all. There's no mechanistic way that a vaccine could do that. And this is something that I don't know where it came from. Whenever possible, we should be really pushing back very hard against this kind of idea, because these are women of childbearing age, are the very group, one of the high-risk groups that should absolutely be vaccinated. So we do know that women who are pregnant who develop COVID end up with potentially very serious consequences. So for that age group, they're going to be doing themselves a favor if they're thinking about having children in the future to be vaccinated, so they can keep themselves and their baby safe.
Well, thank you for that important clarification. Before we continue our discussion, I'd like to take just a moment to welcome those of you who have continued to join us. Please let us know what's on your mind. Type your questions into the question or chat box in GoToWebinar. MS navigators are online throughout today's program, answering your questions and connecting you to resources. Our Ask an MS Expert program takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family and friends and on all your social media channels. The National MS Society convened a group of expert researchers and medical professionals to develop guidance for people living with MS when making decisions about the safety, efficacy, and the timing of COVID-19 vaccines with certain disease-modifying therapies. So let's talk a little bit more about those vaccines. Dr. Sicotte, to ask you a question that I've asked before, but I believe your answer always bears repeating. Are the COVID-19 vaccines from Pfizer BioNTech, Moderna, and Johnson & Johnson safe for people with MS?
Yes.
Thank
And
you.
as time's gone by, I can say that with more and more confidence, as we've been talking about, that for those of you who've been hesitant, just look out and see the proof is in the data that we have. Very safe, very effective.
Does this expert advisory group that you lead recommend one vaccine over another for people who are living with MS?
The short answer to that is no. The vaccine that you should get, the best one for you, is the one that's available to you. And that we have not done any comparison, we don't have that data, for example, but all of the vaccines have been shown to be safe and effective in preventing severe COVID and keeping people out of the hospital. So we don't state a preference for any of the currently approved therapies.
And when is someone considered to be fully protected after being vaccinated?
So 2 weeks after the final vaccination has been completed is the time that we consider that you would be fully vaccinated. So if you receive the J&J vaccine, which is a single dose, it would be 2 weeks after that. If you're doing one of the mRNA vaccines that require 2 doses, it would be 2 weeks after the second dose that you receive. And after that point, that's when we know that the immune response has been achieved and is at its protective level.
After a brief pause, the CDC and FDA recommended that the use of the Johnson & Johnson COVID-19 vaccine be resumed in the United States. Nearly all the reports of the rare adverse event of blood clots after receiving the J&J vaccine were in adult women younger than 50 years of age. What's the risk that women under 50 could develop this blood clot disorder after receiving the J&J vaccine?
So that was a very concerning and important process that the CDC went through in evaluating the J&J vaccine. And what we found was this is extremely rare, this complication. It's 1 in a million doses that were delivered. The other part of it is that there's now widespread recognition. So while it is very serious and concerning, there's now an effective therapeutic intervention that has led to no further evidence of our episodes of death in these patients who may have developed blood clots. So it is the cases we're seeing in women under the age of 50. Again, the risk is extremely low. But all things being equal, if there were an opportunity to not to have one of the other vaccines in that age group, that could be a consideration. But again, I want to emphasize the fact that those risks are very, very low and much, much lower than the risk of having a bad outcome from getting COVID-19. So we have to weigh these things and do a risk-benefit assessment, which is sometimes challenging.
So are women who are under 50 who are living with MS at any greater risk for this condition if they get the J&J vaccine?
There's no evidence that having the diagnosis of multiple sclerosis makes you more likely to develop the blood clot syndrome that has been seen in a handful of cases with J&J. There is no evidence that women living with MS would be more at risk for that we've seen so far.
We know that the CDC monitors new COVID-19 variants. What are we learning about these variants? What do we know?
So the variants are definitely something of concern. And again, to keep banging the same drum, the more that people get vaccinated and the less virus that's circulating in the community, the less likely that new scary variants can develop. The only way these variants can actually come into being is by having more and more human hosts to create these new versions of themselves. So if we stopped transmission, we would stop the variants. I would say that so what we've seen in the variants is, in general, what will happen is they will select the virus that is most infectious will become dominant in a community. And we saw that here in Los Angeles during the very bad surge that we had in December and January. It was being driven by this new variant that was much easier to catch. So much easier, you didn't need to be exposed to as much virus. It would seem to just be easier to transmit from person to person. So, so the new variants as they come will spread more quickly and dominate the environment. The good news is what we're seeing is that the vaccines that have been approved so far for emergency use seem to be very effective for the vast majority of these variants. And certainly the mRNA vaccines here in the United States seem to have been very effective against all the variants the variants of concerns we've seen so far. But that doesn't mean that will be the case forever, and especially if we don't control transmission across the globe. That's really a key public health issue. And I think we've heard some comments about we can't just think about the United States before we're going to be all safe. We have to have the rest of the world has to be safe as well, because we're all, as the pandemic has shown, we're all connected in this.
We've heard from Jamar, who says his doctor ordered a COVID-19 antibody test 4 weeks after he received his second dose of the Moderna vaccine, and the results of that test indicated that he had undetectable antibodies. Jamar went on to say that he's on Ocrevus, and he got the vaccine in the middle of his infusion cycle, like the society's guidance suggested, and he wants to know why he has no antibodies. So first, can you tell us what an antibody test is and what it can tell us in terms of someone's protection from COVID-19?
So this is a very important and hot topic, as I think you are aware. So antibodies are proteins that your immune system makes in response to specific triggers. And a vaccine is one of those triggers where the immune system gets activated. Certain group of cells called B cells get activated to respond to that. And in response to a new antigen or a new infection, we'll develop these proteins that are very, very specific, targeting this infectious agent or the component of the vaccine that was delivered. And individuals who are on certain kinds of medications, like ocrelizumab, like rituximab, and now ofatumumab, will see that the amount of antibody that they make will be decreased. And this is known because of the way those drugs work, which is to eliminate a certain class, a certain percentage or population of those B cells that go on to make the antibodies. What I want to emphasize, and I think this is the next set of questions that we'll be addressing, is the lack of antibodies does not necessarily correlate with a lack of immune function or immunity to the virus. And why I say that is there are other parts of the immune system that seem to be very important in protecting people from getting COVID-19. And that's a whole nother part of the immune system called T cells. And we know that T cells are important in providing protection from viral infections. And so what we don't test currently is the whole immune response to the virus. So getting an antibody test like that is only telling you something about one part of the immune system, and it's not giving you information that is actually telling you whether you would be immune if you got exposed to the virus. So I know the CDC has recently come out with guidance regarding this, to not rely on these antibody tests to determine whether or not you're immune to the virus. And there's still a lot of work that we need to do to really understand how the immune system is responding to vaccines in people who are on not only those B cell depleters, but other immune suppressing medications other than the B-cell depleters.
To your point, Bethany wrote in because she read about a study from Israel that showed that the vaccines are not very effective for people taking Gilenya and Ocrevus. She wants to know whether the society would be changing its guidance. So what can you tell us about the Israeli study, and will the society be changing its guidance?
So these are great questions. So the Israeli study is sort of the first of what I anticipate will be many studies done to help us get a better sense of exactly how the immune system is responding to the vaccine in individuals who are on disease-modifying therapies. And they were looking again at one very specific part of the immune response, which is the antibody levels. And there were differences among different treatments, including the B-cell depleters and including fingolimod and similar kind of medications that seem to have lower levels of antibodies. So that is an important data point, but as I said, it doesn't tell us the whole story, because the whole story is in individuals who've been vaccinated, even if their antibody levels are not elevated, are they getting infected with COVID-19? And that's going to be the real piece of epidemiological information that will help us to answer that question. Because so far, we are not seeing large numbers of people who've been vaccinated, who are on B-cell depleters, ending up with COVID-19. So that's telling us that even in those circumstances, that the vaccine is giving some protection. So we are not currently anticipating a change in our guidance, but it does go along with the notion that we're in this kind of transition period as we're moving out of the pandemic, where we were getting more and more use of the vaccines, but we have a lack of good, solid data to guide us in this risk information. So we are very much focused on finding out more as time goes on and learning more and providing that in a very transparent way to people living with MS so they can make those decisions.
April wrote in to ask if people with MS will be able to get boosters to enhance their protection. And this question seems particularly relevant to those taking DMTs that might decrease the effectiveness of the vaccines. So what do we know so far about boosters?
So I can tell you what I've read, and I don't have any special inside track here, but it does seem to be a growing consensus that there will be then a need for a booster. It may turn out to be something like our annual flu shot that we all, or most of us, are receiving, and it may be that I hope and I anticipate that we'll have enough information to know how to target those boosters. So maybe there are specific individuals, such as those living with MS on certain DMTs, people who've had solid organ transplants or who've had cancer. Maybe there'll be this group that will be targeted to get a booster. I do think boosters are in our future. I heard a very promising comment that made me very happy that we might get a global coronavirus vaccine that would protect us against all coronaviruses. And since we know that the next pandemic is much more likely to be another coronavirus pandemic, I would be thrilled if we could do that with a booster and decrease the likelihood, and also the common cold. So that could be a real silver lining. But I do think boosters are going to be in our future.
Well, as we look at the rising numbers of people being vaccinated in the US and the falling numbers of people being diagnosed with serious cases of COVID-19, the vaccines are proving themselves to be effective at preventing COVID-19 and reducing the risk of spread. So the CDC recently updated their recommendations to allow fully vaccinated people to resume most activities without wearing a mask or physically distancing, except where required by local laws or regulations. But let's talk about how these updated recommendations from the CDC apply to people living with MS. We just talked about not yet knowing how protected someone with MS who's on certain disease modifying therapies is, even after being fully vaccinated. So what should people with MS on these DMTs do? Do they continue to wear a mask when they're out?
So it's a great question. And I will quote my colleague, Dr. Ann Cross, who says, get vaccinated, but act as though you're not, which means go out, get vaccinated, excuse me, wear your mask until we get more information. And I think we've all realized that wearing masks is uncomfortable and annoying, but doable. And especially, I would just, I would use my recommendation for my patients is just to use common sense in a setting. If you're in a situation where you don't know all the people, where people are close together, where there could be potential that somebody has an asymptomatic infection, wear your mask. We have to still wear masks in the healthcare setting. We have to wear masks when we're traveling on airplanes. And I would say for people in those categories, just as you see individuals who are undergoing chemotherapy, they will wear masks to protect themselves against other kinds of infections as well. So I think we need a little more patience and a little more data, but I think that would be the safest thing going forward. But the good news, as you said, is that we're seeing much less virus out there, much less community spread, and so the risk continues to drop significantly, which is good news for all of us.
I think this next question sort of relates to some of your remarks about being sure to use common sense and think about the best path for you. Patrick lives with MS, he's fully vaccinated, and he read that COVID-19 cases from some of the variants are increasing in his community. And he wants to know whether he should be following those new CDC recommendations, or should he be wearing the mask?
Yeah, so as I said, the variants, we're still learning a lot about them. So if there is an upsurge of cases in your community, this just means there's a lot more virus that's circulating around, and that would be the time to be more cautious. So I would say that my recommendation would be keep your mask on. Don't throw your mask out quite yet, especially if local conditions are such that there's more community spread. And then you have to find your pod and your bubble, right? You know, your family and your friends, and you know those around you who've been vaccinated. And in those situations, I think you can feel comfortable to remove your mask. But if you're in a community setting where you just don't know the status of those around you, keeping your mask on for this time is a smart move, I think.
Sandra wrote in to say that the recent changes to the mask recommendations have her completely confused. She wrote that first, the advice was to wear a mask to protect others. And then the CDC told us that wearing the mask could protect ourselves. And Sandra wants to know who's being protected now if we wear a mask. Is it ourselves? Is it others? Or is it both?
Well, I think it's always been both, right? I think the idea being that because we know that there are asymptomatic cases out there, you could be spreading the virus when you feel perfectly fine. So that's one reason that we wanted, and the recommendations were for everyone to wear a mask, because you just don't know if you could be spreading it yourself, and no one wants to be that person. On the other hand, you don't want to get the virus from somebody else either. So the mask really works both ways in terms of protecting you as well as protecting the community. I would say the good news that we're learning over time now is that people who are fully vaccinated are extremely unlikely to transmit the virus. So, so in some ways, that's led to the CDC recommendation for fully vaccinated people that they don't necessarily have to wear masks in most situations. But the caveat, of course, is the local ordinances. So here in California, for example, we are not formally opening up until June 15th. So there's still local requirements that you wear masks when you're in stores. And again, here at the medical center, that mandate will not be stopping anytime soon. So we're all anticipating that we will continue to wear our masks, which is to protect ourselves and also to protect our community. It really is both. That's why the mask mandate has been out there.
We heard from Ben, who lives with MS. He and his wife are fully vaccinated, and Ben's wife is ready to start socializing with friends again. Ben's nervous because he knows his wife could really benefit from some socialization. He's asking for tips on how he can stay safe, but also enjoy time with his wife and their friends.
So congratulations that you're both vaccinated. That's fantastic. So your wife, who's fully vaccinated, as we were saying, is unlikely to be able to transmit the virus, even if she were in a situation where other people maybe weren't all vaccinated. But I think, again, common sense and dipping your toe in the water. So I would, certainly encourage people to have socializing and to get out there, because this is so important for our mental health. I would say you want to start with a group of people that you know are also vaccinated, and to make sure that your group is relatively small, and to just sort of take it step by step. I think you are at increased risk for being exposed if you're in a setting where people are very close and where you're indoors. If you're in an outdoor setting and people are not close by, then the risks are, again, are decreased. If you're with friends that you know well and everyone is vaccinated, that's a situation where you can take off your mask and feel comfortable. It's just this question of not knowing for sure when you're out in public how many people have been vaccinated and how many haven't. So what I would say, start slow and build confidence, and we will continue to have data that will allow us to make good decisions based on what we see out there in the public. As things open up, it will become clear. I just don't want my patients to be in the vanguard of that. Let the other healthy folks get out there and do it first. But I am very optimistic that we, as the summer goes on, we're going to see and people feeling more and more comfortable getting out and about, which we all need.
Well, people are making plans for their social lives, and they're also thinking about their work life. We heard from Kim, who's living with MS. She says that her employer has been letting everyone work from home during the pandemic, but recently opened the office up for employees who are fully vaccinated to return. Now, she's not required to work in the office, but Kim says she misses the regular interaction with her colleagues. Since she's fully vaccinated, she's wondering if it would be safe to go back to the office. What advice might you have?
So I think this is a great example of kind of looking at the risks and the benefits and balancing those. So it seems to me, if everyone, and it's verifiable that they're vaccinated who are there in the office, and the benefits of having that social interaction are real, that's a situation where she should go back and work in the office and be in that environment. I think in that setting where only people who've known to be vaccinated are there, we know, again, from the data that's been accumulated, that the likelihood of transmission is extremely low and that people will be protected. So I think we're all going to be going through this. What do we feel safe doing? We're going to have to, I think, take these confidence building steps going forward. But I think that's a kind of an ideal situation where you know beforehand that only people who are vaccinated are the ones you'll be coming in contact with. So as long as you're vaccinated, that's great.
Well, as always, Dr. Sicotte, you've shared a lot of important information with us today and addressed questions that are on the minds of a lot of people right now. But what would you say are the top 3 takeaways that you'd like our audience to remember?
So get vaccinated, and for your teenagers, also please get them vaccinated. Again, the more people that are vaccinated, the fewer people that can transmit in the community, either symptomatically or asymptomatically. And it will be great to get the younger people who are probably the most common source now of transmission, since older people are more vaccinated. So that's number one. Number two, don't throw out your mask yet, but there are going to be some situations where you're going to be able to take it off, especially if everyone around you is vaccinated, and you're in a situation where you feel confident of that information. And then finally, I would say the other takeaway has to do with the antibody tests. Don't rely on the antibody tests to tell you whether you're vaccinated or not, whether you're protected or not after vaccination, because we just don't have enough information to be able to feel like that is definitive. And I think you should feel people should feel reassured that we have not seen large numbers of individuals on those DMTs coming down with COVID-19, even though the antibody levels may be diminished.
Well, thank you for sharing your expertise with us, Dr. Sicotte. Let's continue answering questions from our viewers. We heard from Dan, and he wants to know if having no reaction to the second vaccine shot means that he's mounted a lower antibody response, and so he has less protection.
Yeah, I think I addressed that when I talked about my mom, the 95-year-old. So there's no evidence that that's the case. And again, if we looked at something to feel happy about, if you look at nursing homes now and nursing home spread, it's gone down to minimal levels. So even in those much older people who are less likely to have those kind of physical symptoms in response to vaccination, we're seeing that the benefits of vaccination have been realized, and we are not seeing disease transmission. So I would not, definitely can't say one way or another based on the lack of symptoms.
Kay wants to know whether any formal studies are being done to measure the efficacy of the vaccine with MS disease-modifying therapies.
So it's a great question, and the answer is yes. The National MS Society is convening a group. In fact, we're meeting next week to really start talking about what are the research studies that need to be done to get the information to help our patients make decisions and feel confident going forward. Again, we just have to remind ourselves we've been living with a brand new virus, a pandemic situation for only 14 months. There are a lot of unanswered questions, and a lot of them have to do with this. Now we're getting into this, well, you've been vaccinated, how do we know that you're protected? And how do we know that these groups of people on certain medications are protected? So we're going to be working with the National MS Society to come up with the very most impactful studies that can be done to answer that question. And also there are lots of other groups around the country and around the world who are addressing this issue. Again, not just from the autoimmune standpoint, but from the transplant and people living with cancer or who recovered from cancer. So there is a large number of people where this information is really critical. And so I think that's the next step of where we need to go. And it'll have benefits not only for this virus, but for other viruses and other infectious agents to help guide us and really increase our understanding of how the immune system responds to vaccines.
Lakeisha has heard that women should wait 4 to 6 weeks before their second dose, after their second dose of the vaccine, before having a mammogram. She wants to know why that is.
So this is something I have to say I have just started reading about, that there was some evidence of some funny changes on mammograms after receiving the mRNA vaccines. This does not mean that there's an increased risk of breast cancer or anything like that, but that mammographers are noticing differences on the mammogram that might be related to the vaccine. But I have to say, I don't know a huge amount about that. I would say it's likely a transient effect of probably the immune response. Maybe their lymph nodes are slightly more enlarged, and that they're leading to some anomalies or signals on the mammogram that are harder to read. But I have to say, this is just a brand new thing that I saw, I think yesterday or the day before. So again, I would reassure your listener that there's no evidence of increased risk of breast cancer, and that 4 to 6 weeks is just to sort of let the immune response die down. So that's my understanding of that recommendation.
And I have to apologize, I didn't catch the name of this viewer, but I did get their question. And they point out that summer's almost here, and they want to know that if you've been fully vaccinated, is it safe to plan a vacation?
Yes, I would say go for it. Absolutely. You will know that you'll have to wear a mask on the airplane, and there'll be certain places where you'll have to take extra precautions. But if you're fully vaccinated, then you should get out there and go have some fun. Now, where you end up going, I would say the safest places to go are within the US. It seemed like everyone and their brother went to Hawaii recently. Hawaii is also very safe. They have a really rigid program there of getting tested and so on. So that's a very safe place to go. So I would say, maybe this summer, stick with the US, maybe the UK, but you should look around the world and see where the hot spots are before you plan your trip.
Well, I want to thank all of you who submitted some great questions today. And thank you, Dr. Sicotte, for being with us.
Thank you, John. It's been my pleasure. And thanks to everyone for their really challenging and informative questions. See you next time.
See you next time. I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are resources that you can count on to be current and credible. For additional information on the COVID-19 vaccine guidance for people living with MS, and the latest information and resources in general related to COVID-19, please visit the Society's website at nationalmssociety.org/coronavirus. I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. I'll also remind you that the MS Society brings people together through peer connection programs like self-help groups, the MS Friends Helpline and Paired Program, and the National MS Society Facebook community. To learn more, please visit the Society's website at nationalmssociety.org/connections programs. Every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you'll take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. Don't just ride, bike MS. Bike MS is more than a ride of a lifetime. Whether you want to cross the finish line in person or take on a new challenge from anywhere, there's a Bike MS event that's right for you. Please register at bikems.org. You can connect with the National MS Society along with others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. I encourage you to like those posts, subscribe to the channels, and make sure that you're on the Society's mailing list so you'll continue to receive the latest information on MS and updates on upcoming programs just like this one. I'd like to thank Dr. Nancy Sicotte for joining us today. Please remember that a recording of this webinar will be available at the Society's website at nationalmssociety.org/MS expert. as well as on Facebook and YouTube. We're taking a break next week to celebrate Memorial Day, but we'll be back on June 4th with a new episode of Ask an MS Expert. And you can always find our upcoming program topics on the National MS Society's website. Now I have a favor to ask each of you. Getting your feedback on today's webinar is important, so you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. On YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Nancy Sicotte and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.